Mainly there is a storage of the blood is the main physiology of the traditional medicine. What is storage of the blood? As I told you, it stores. How it stores? For the female, woman and then male, it differs. But of course it stores to both of them, but you will detoxify every month. You will scatter that blood which is stored in the liver, that will be drained out at the time of the menstruation for the female. But by the way, if you are healthy, then you understand the liver is beautifully supporting to you. That's the reason liver having the major role to protect our body, nourish our body in the form of the blood to entire top to bottom. Hair fall is there, or the face charishma is not there, the eyes are very dull, the limbs are very weak, then you understand this is liver is not supporting you. The liver blood is not enough quantities storage, because whatever you are eating, that is the malnutrition is taken place. That's the reason it's not supporting to our body system. And of course, as I told you, the maximum 1.5 to 2 liters of the blood always should be there as a reservoir of the blood. Reserve Bank of India to keep the money under that. At the same time, to blood should be stored in the liver. You understand, this is supporting to the cardiac system with the support of the superior and then inferior vena cava. You know the veins, the biggest vein in our body is, come on, good, superior, inferior vena cava is the biggest veins in our body. Biggest artery is aorta. Biggest nerve is, very good, sciatica, right? So in that way, biggest bone is, smallest bone is
clavicle.
Very good, wonderful, inside the ear, right? So in the same way, so now we understand the storage of the blood. At the same time, it is protecting to the cardiac system with the support of the liver system. The liver and then heart very close to each other. Of course, this is located on the right lower cavity. There is the cavity is called as a middle cavity. Liver is located. Upper cavity is the cardiac system is located. But in between there is a junction. The junction to be known as a vena cava. Through the vena cava, directly and indirectly, is supporting based on the modern medicine. At the same time, based on the perspective of the interior energy pathways, is communicating to the cardiac system. I strongly believe that heart is the monarch for all the organ, the king of all the organ. I love to say, but liver also is the monarch for all the organs. It's not that cardiac system. Of course, this is there. When you intake of the food to be taken place precisely with the support of the small intestine, that is nourishing to the liver through the portal vein, and then through that liver is communicating to the cardiac system. When the heart should function precisely, the heart should get the enough amount of the blood to the body system to push the blood to the upward and downward direction. Then what is required? The blood is required, but how you consume? As I told you, the pre-essence energy or the prenatal energy, the parents given you the energy, the second energy to be known as a adequate energy to be taken in the form of the food. That food energy is supporting to the cardiac system through the liver system. So therefore, liver is major essential role to regulate to all the organs in our body. When the heart is good, then the mind also good and the brain also good. When the heart is good, through the coronary arteries, through the carotid artery which supplies to the brain system. When the carotid artery is weak, then you understand the enough blood is not there. The liver is not giving enough blood to the cardiac system. Due to that reason, the heart is not pumping the blood to the across the body. When the brain having the function is less, then you understand it is not related to the brain problem where the middle cerebral artery or the posterior cerebral artery or anterior communicating artery or the circle of Willis anywhere having the problem. Then you understand. तुम अंदर चले जाओ, अंदर बैठो. Anything that having the problem, हिदायत भाई आप भी अंदर बैठो. So anything having the problem, that's indicating there is some kind of the issues in the liver system, not on the cardiac system, not on the brain system. Of course, based on the perspective of the analytical system of the echocardiograph, angiogram, so anything has been done, ECG, electrical conductivity to be taken place. Of course, that is pertaining to that particular organ only. That particular organ only. But of course the traditional medicine says that in the initial stages, if it is the lot of blockage is there, of course the conventional treatment to be taken place or the modern medicine support to be taken place. But the traditional medicine says that when in the initial stages, when the cardiac system is not precisely functioning, then take the energy support of the mother organ. Based on the 5 elements theory, the liver is supporting to the cardiac system. When the liver is good, then the cardiac system also good. That's the reason it's storage of the blood to be taken place by the liver organ only. Of course, that indirectly is opposed to the spleen as well. The liver over controls to the spleen and then pancreas. That is a different topic. Now one physiology is over. The second physiology to be known as it controls and regulates to the sinews. What is sinews? Sinews is nothing but is the very hard fibrous tissues, which is ligaments, cartilages, tendons, muscles, bones, all collectively known as, sometimes it says it is the sinews. But there are nearly, how many sinews are existing in our body in generally? Approximately, anyone in the Zoom? Nearly 4,000 sinews are existing in our body. Look at about collectively all the muscles, 642 muscles, so many tendons, ligaments, cartilages, bones, collectively known as nearly 4,000. You look at about, for example, is the shoulder having the 4 ligaments or the 4 hard tissues or muscles, supraspinatus, infraspinatus, subscapularis and teres minors. So where the rotator cuff muscles also to be known as this. So in the same way, the entire body based on the person's body size and shape and then mass level of the muscles, because each and every muscle having the great information, great support to the cardiac, great support to the ligaments and then cartilages and also tendons. So therefore it controls and regulates the sinews in our body, that indicating, as I told you in the beginning, the origin to cause the problem of any kind of the pain conditions, it is connected to the liver. But of course in the acute problem is connected to the gallbladder, and then the chronic problem to be regulated by the liver. So therefore you understand the acute problem is that's the reason there is the influential point for the musculotendinosus system. That point to be known as which point? Influential point for? Very good, wonderful. GB34 is the Yang Ling Chuan is the musculotendinous system connecting point. So therefore this is the chronic diseases are there, the chronic arthritis is there, chronic rheumatism is there. That particular time it is the polyarthritis or the monoarthritis or the rheumatoid arthritis or the cardiac arthritis, so on. So can be treatable by activating to the liver meridian. If there is a chronic problem of the muscle movement is there, hemiplegia, paraplegia, quadriplegia, tetraplegia, anything connected to that, even that condition also recommended to use which meridian? liver meridian, liver organ to be activated. Now let me see what are the points also really essential to regulate the sinews, and till 2 o'clock you should stay with me so that I can tell you the secret of those points. Only very few points. Ta tun sing tian tai chung chung feng lu ku ta chung chu chuan si kuan su hai chi lian chian lian chi mai chang men chi hai chi chung. Something is connected to only very few points. You will going to amaze that. So to understand, only very few points are there. In that you can filter it and you will get only 1, 2, 3, 4 points. That's it. So that 4 points you learn, you can do the wonders. So hopefully you can learn that. The next mechanism, function of the liver to be known as it gives the direction of the chi to the entire system of the body. So that means it is regulating to the top to bottom in our body system, because there is the certain directions are there in our body. Because I wanted to come to this place, there is a passage. You wanted to come from the Kamanahalli or the Hosur or the Mysore or somewhere, then you have to reach one pathway to reach this destination. In the similar way, each and every organ having certain pathways to reach the respective destination. So indicating that the lung should descend the downwards direction, the stomach should descend the downwards direction of the chi, and then the spleen should ascend the upward direction of the chi, and the cardiac system scattered to the up and downward direction of the chi, right? In the similar way, the cross intestinal ascends the upward direction, triple warmer ascends the upward direction, and the small intestine ascends the upward direction, and also descends and supposed to the direction to the vesical organ. So much information. But here the liver also major role, indicating there are the certain pathways are there. Those pathways to be known as a inward pathway, outward pathway, exit pathway, and then inward and then exit, interior and exterior pathways. That means the east, west, south, north direction. In all the directions, the chi scattered from the across the body. That is the beauty of the liver, because the stomach should go upward direction, which causes the nausea, belching, hiccup, and then vomiting, so on. Whereas in the spleen, it goes to the downwards direction. It causes the diarrhea, sprue, and then barbarismus, and then the dysentery, so on. In this way, liver is stagnated. Of course, it is stagnated. You are like a statue. Ankylosing spondylosis, yes, you need to walk like something is like a statue, is pushing to statue. So in this way, now we understand about the anything related to the movements required, that movements to be taken place precisely by the which organ? Liver organ. So therefore, from the top to bottom, the direction of the chi is moving from the across the body. Of course, this takes the support. According to the TCM, one organ cannot exist without the support of the any other organ. That is the nature. The man cannot exist without the support of the wife, so on. So sun is there, moon is there, right? Day is there, night is there, hot is there, cold is there. So therefore, the liver is there, that communicating to two organs. One is the kidney organ, the second organ is the cardiac system. So combined together, the lower portion is pushing the energy to the liver is moving towards the cardiac system. So therefore, all the directions, the energy to be scattered and then bifurcated and then distributed and administered to the entire system of the body is hepatic organ. That is the beauty of the hepatic organ. At the same time, it controls all the tendons, as I told you. Wherever there is a tendon problem is there, Achilles tendon problem is there, bicep tendon is the problem is there, or the semimembranous tendon is there, or the peroneus longus and brevis tendon is there, femoris tendon is there, bicep femoris tendon is there, or the adductor muscle tendon. Anywhere there is a problem is there. So that tendons to be regulated by activating to the which meridian? Good. Now the another physiology to be known as it regulates the eye system. Eyes are manifesting the problem The clinical manifestation of the eyes are regulated by the which organ? Liver. You look at about the various concepts are there related to the eye system. The liver is somewhere, but eye system is somewhere. But when we talk about the divergent meridian pathway, how the energy is communicating to the vision and how the energy is communicating from here to the communicating to the brain. So the energy is interiorly, energy is moving and communicating to the brain system. At the same time, when there is the liver is the portal of the eyes. The liver is nourishing. Whenever we blink our eyes, whenever we close our eyes, the moisturizers to be taken place. So that means the liver is, when blinking the eyes, that means the liver is supporting to the eye system. The liver is supplying to the blood to the eye system, and blinking and then moving also to be taken place with the support of the liver system itself. When we feel the hungry, so that hungry is reflecting on the which organ? Sense organ is eyes. We feel the hungry, not hungry, angry, right? When feel the angry, not feel. When we get the angry, that time what will happen? So certainly we see that before putting the words and then reflect on the eye system. When there is a jaundice is there, that also reflecting on the eyes. Jaundice is connected to which organ? Liver. And also according to the Tcm spleen as well, spleen color is yellow, but this all reflecting on the eye system, but indirectly the liver also impacting on the eye system as well, right? So whenever we feel there is a problem in the eye system, is the cornea problem or the lens problem or the aqueous humor problem or the retina related issues or the retina pigmentosa or the macular degeneration or the retinal atrophy of the nerves. So when anything the occipital visual cortex is not functioning precisely, that also indirectly communicating through the hepatic system only. Of course, there are the nervous system, optic nerve, ophthalmic nerve, obtuse nerve, right? The controlling to the eye muscles and then eye movement. So many nerves, cranial nerves, there are the 4 to 5 cranial nerves are supporting to the vision. But at the same time, directly and indirectly, those arteries and those nerves should work precisely. Then which element is required, which organ is required? When the liver is supplied to the cardiac system, the cardiac system is supplied to the central nervous system. So if it is good, liver is good, the central nervous system also good, and cardiac system also good, and then neurons and then nourishment to the nervous system also precisely works wonders. So hopefully you understand, when we wanted to treat anything, the acute problem of the eye system to be regulated by activating to the one single point to treat for the vision related disorders, that will be known as a Guang Ming. G-U-A-N-M-I-N-G. Guang Ming. So that is M-I-N-G. Which point is it? Good. GB 35. No, 37. Guang Ming. GB 37. Dr. Jefferson is here, so he is the medical doctor and who completed acupuncture. Sir again is back to this program. Thank you, Dr. Jefferson, sir. And give any comments from your side if anything if I miss my track, right? Right. Now another concept which I told you, anything there is the GB37 is the good point to treat for the vision related disorders. Of course, bilaterally we can give the pressure, ask the patient to give the pressure bilaterally, both the sides continuously giving the pressure, or needling bilaterally, because Guang Ming, that indicating the name itself is the opinion name to be known as a brightness of the eyes, right? The name itself is, yes, sorry, cataract conditions, yeah, definitely we can use it. See, cataracts are the numerous types are there in the diabetic cataract or non-diabetes or the aged cataract, right? So if it is the primary level is there, initially started at the age of 40 years, 45 years, 50 years, less than that, certainly we can use this. Even spectacles you are using, but even you have with the intention, I wanted to withdraw this, certainly keep giving the pressure on GB37 regularly for the span of 6 months. You can feel the drastically results. 2 minutes give the pressure on the right side and 2 minutes just to give the pressure on the bilaterally it is recommended. So further physiological aspect to be known as a
Should we tone or sedate?
give the pressure perpendicularly as a not as a tonification and sedation to that particular point. You just apply the pressure, that's quite enough. So
Put the needle.
that is a luo connecting point. It is only the nexary point, but you may not require as a tonification and sedation. Of course, it is a sun point or the mother point or something is there that to be activated as a tonification or sedation, but in this point is not like that. But the point is located perpendicularly, that location on the peroneus longus muscles, that point is located, only giving pressure is that's quite enough, right? We are the acupuncturist, we are inserting the needle to that particular region is really good, right? Bilaterally at least 1 to 1.5 tune deep needling to be done on that specific region. Now we will understand about the regulating to the nails as well. What is nails? Nails is the window of the health. That means you see all of your nails, whether it is really good nails or nails having some kind of the deviation, cracks, or the cuticles are there or not there, or there is some dead skin is there on that nails, and also there is a half moon is there on the nails, all are connected to the, this is in fact to be known as a end product of the sinews to be known as a nails. In our body, the millions of the cells die every second. At the same time, rejuvenation to be also to be taken place, right? That time the dead cells convert in the form of the sinews. That sinews will end on the nails, which we call as a matrix. So matrix cells produces these nails, and then further finally it the last or the tip of the nails, that is there is no sense at all, there is a senseless. That's the reason we cut our nails, we manicure our nails, right? So therefore the nails are belongs to the three organs in generally, one to be known as a liver, the organ to be known as a lungs, the third to be known as a heart. So any impairment of these three organs in our body, that also reflect on the nail system as well. So therefore now we remember the nails are belongs to the, if anything there is the nails are moving inward direction, or the nails are deviating on the other direction, or the nails having the cracks on that, or there is something is fungal infection is there on the nails, that means it is indicating there is some problem in the internal organs as well. So therefore now we understand the nails also precisely required is the healthy way. This is called as a nail diagnosis as well. Look at about the nail root or the body or the shaft or the rim of the nail to understand what exactly. So if there is a very pale nail is there, that also indicating we know that deficiency of the anemia, that means is the liver having the less energy, which causing the paleness on the nail region as well.